Welcome to We Have a Spiritual Problem, a podcast exploring the deep interconnections between personal wellness, societal challenges, and spiritual growth. Hosted by Dr. Jeff Armstrong, this thought-provoking series tackles the big questions. How do we cultivate a well-centered life in a world that often feels unbalanced? What role does spirituality play in solving today's personal and collective problems? Drawing from concepts of well-centered fitness, spiritual, physical, intellectual, emotional, and social wellness, we bring you engaging conversations with experts, thinkers, and everyday people who challenge us to rethink our approaches to health, happiness, and harmony. Whether you're seeking balance, looking to deepen your spiritual understanding, or curious about how wellness connects to social change, this podcast offers actionable insights and inspiration. We talk about a healthcare crisis, but what if the real issue isn't healthcare at all? What if it's a spiritual problem? This suggests that our healthcare crisis is about more than access to doctors or medicine. It's about more than access to exercise and healthy foods. It's about more than processed foods and food additives. And it's more than BMI and obesity. The health crisis that confronts us reflects a loss of purpose, discipline, and interconnectedness. The healthcare crisis is, well, it is a spiritual problem. Remember, on this podcast, we don't define spiritual as a religious construct, per se. We define spiritual as the knowledge and understanding that there's something greater than self. In this episode, I want to share why I think it's a spiritual problem. As of 2025, several concerning statistics highlight the state of health in the United States, particularly regarding obesity, chronic diseases, and the economic burden of preventable conditions. Let's consider obesity rates. In 2023, data revealed that in 23 states in the United States, more than one-third, that's 35%, of adults were classified as obese. Notably, prior to 2023, no state had an obesity prevalence at or above 35%. A study published in The Lancet in 2024 indicated that nearly 75% of U.S. adults are either overweight or obese, marking a significant increase from just over 50% in the 1990s. Currently, obesity affects approximately 1 in 6 children in the United States, underscoring the urgency of addressing this issue from a young age. Chronic diseases, including heart disease, stroke, diabetes, and cancer, are the leading causes of illness, disability, and death in the United States, accounting for a substantial portion of healthcare costs. U.S. residents spend an average of over 12.4 years of their lives burdened by disease, which is higher than the global average of 9.6 years. The economic impact of this is tremendous. Obesity is estimated to account for more than 20% of healthcare expenditures in the United States. Medical costs for obese individuals are 30% to 40% higher than those for normal weight individuals, with the direct cost attributed to diagnosing, treating obesity, and related conditions like cardiovascular disease and type 2 diabetes. These statistics highlight a critical need for comprehensive public health strategies focused on prevention, early intervention, and effective management of obesity and chronic diseases to improve health outcomes and reduce economic burdens. As an exercise physiologist, I know that these problems go beyond daily decisions that Americans make. These are hypokinetic diseases, but it's not as simple as telling someone to lose weight, exercise, and eat a balanced diet. It's also not a problem that we can write off as personal choices or genetic. The health problems that we face as a nation and globally are not so simple, yet they go beyond just policy and infrastructure. I teach a course in pathophysiology and exercise. I highlight that health span can be summed up in 6 actionable pillars: exercise and physical activity, a healthy diet, maintaining a healthy body composition, not smoking, proper sleep hygiene, and purposeful social connections. One learning activity that I require of my students is to read the 1968 article by Garrett Hardin titled The Tragedy of the Commons, and reflect on how this pertains to our health and our healthcare system. In short, The Tragedy of the Commons is about how individuals making self-interested, short-term choices deplete collective resources. In the context of health, we consider healthcare to be a limited resource. There are many examples of how healthcare is a commons. We consider how the processed food industry prioritizes profit over public health, overuse of pharmaceuticals instead of addressing root causes, the overburdening of the healthcare systems due to preventable diseases. The list goes on. I mean, there are so many different things that we are doing in a selfish manner, either to make profit or to consider only our own self-interest, our short-term gratification, and so on, that creates health issues that burdens the healthcare system and takes away resources from people who really need them, people with, non-preventable diseases. So I believe that the tragedy of the commons is a spiritual problem. The loss of responsibility for community health and personal well-being. We have given up on our responsibility for most anything. It's not our fault. We are entitled. We look at the role of self-discipline and purpose in reversing this trend. I believe there is a crisis of purpose. This lack of purpose and understanding that we all have a role to play in the universe is at the root of our health decline. It is notable that people with a sense of purpose live longer, have lower rates of depression, and make healthier choices. Consider blue zones. Blue zones are regions with high longevity. In these blue zones, purpose is a key factor in aging well. Many people feel lost in careers, relationships, and personal growth. Society places greater emphasis on materialism, entertainment, and passive consumption over meaningful engagement. So without a sense of purpose, where do people turn? People turn to comfort to fill the void. They turn to things like food, alcohol, social media, and pharmaceuticals. We need to reclaim purpose. We need to take personal responsibility in finding meaning. I believe a means of rediscovering purpose can be found in embracing what I call well-centered fitness, or what my friend Jay labels as SPIES. Well-centered fitness, or SPIES, provides a blueprint for true health. SPIES refers to spiritual, physical, intellectual, emotional, and social wellness. Spiritually, we consider how the lack of meaning fuels unhealthy habits. Physically, we see a preference for biohacks over discipline. We see how people favor fad diets, quick fix supplements, and pharmaceutical dependency. Intellectually, we consider the importance of critical thinking in resisting manipulative health messaging. Emotionally, we see how stress, anxiety, and emotional wounds drive unhealthy coping mechanisms. And lastly, we see the impact of social isolation and lack of community on physical and mental health. There is a call for action. We must shift from external fixes to internal transformation. We're in the midst of a loneliness epidemic. Loneliness is linked to higher mortality rates, increased inflammation, and a weakened immune system. I've heard it said that loneliness is equivalent to smoking 15 cigarettes a day in terms of health risks. How did we become such a disconnected society? We can consider the breakdown of family and community structures, the illusion of connection through social media, the prioritization of work and productivity over relationships. Humans are wired for meaningful connections. The importance of service, mentorship, and community involvement are lost on many of us. I often consider the loss of the front porch. And when I was growing up in a little town called Dormont, suburb of Pittsburgh, every house had a front porch. And we were a small, tight-knit community. You walk down the street, you might see your friend's grandmother up on the porch. You're talking to one another. People are knowing what's going on. They're watching out for their neighbors. They're watching out for the kids. There was a much, much greater sense of community. You knew people in your neighborhood. You communicated with people in your neighborhood. You felt connected. There was a certain sense of connection and community. We're living in a society now of suburbs and high rises where we don't have front porches anymore. People live in their backyards or in their houses. They don't necessarily interact with their neighbors other than maybe a how you doing, and not really meaning to get an answer from that question. So let's consider for just a moment the effects of stress, poor sleep habits, and the modern lifestyle on our health. Many are under chronic levels of stress. Now, stress like exercise and challenging circumstances can be beneficial as they can stimulate growth spiritually, physically, intellectually, emotionally, and socially. But chronic stress and excessive stress disrupts our physiological systems and ultimately our health. Cortisol is often labeled as the stress hormone, although it's really more of a regulatory hormone. Chronically elevated cortisol levels, however, contribute to weight gain, high blood pressure, and a weakened immune system. So the modern lifestyle tends to keep us in a chronic state of fight or flight. We're not sleeping well enough, so our body's perceiving that we are in a situation where we are either going to have to turn and fight or flee from the situation. Now, high stress is a high fight or flight response. And in addition to chronic elevated stress, over 30% of adults don't get enough sleep. This increases their risk for heart disease, obesity, and neurocognitive decline. The lack of sleep leads to an over-reliance on stimulants, caffeine, and sedatives like alcohol and sleep aids as short-term fixes. There's a lack of stillness and reflection in the modern life. We're always on the go. We rarely take time to relax, and to relax in ways that take us out of that fight or flight mode. Often our methods of relaxation involve video games, movies, television, sports entertainment, and so on. And this still keeps us in that state of chronic fight or flight. Many ignore or dismiss the role of spiritual or mindful practices in lowering stress. Things like prayer, meditation, and gratitude. And I'm on a mission to change the spelling of gratitude to include 2 T's as an attitude of gratitude. So what are the solutions? For one, we can begin to prioritize restorative practices like exposure to nature, social connection, and structured downtime. We can also begin by rethinking success beyond productivity. And what about the pharmaceutical industry? What role do they play in this problem? Big Pharma gains tremendous profits from treating symptoms rather than root causes. We seem to be a society that favors medication over lifestyle changes and preventative strategies. We are seeing an increased privatization of hospitals. One can make a strong argument how business-driven healthcare leads to high costs and poor outcomes. This is not without ethical concerns. Increasingly, we are seeing hospitals treating persons as customers rather than patients. This is not necessarily the fault of physicians. It's a symptom of a spiritual problem. Should health be seen as a commodity or should it be seen as a sacred responsibility? Personally, I see health as a sacred responsibility. I see it as a social responsibility of communities and governments to provide access to health. And I see it as a personal responsibility to maintain health as best as we are able. I see health through the lens of the tragedy of the commons. Our poor health is a product of unhealthy habits and cultural conditioning. It is personally repulsive how the food industry and government agencies have driven the decline in our national health. It is disturbing how marketing, government subsidies, and corporate interests shape unhealthy diets. There has been a normalization of fast food, ultra-processed foods, and sedentary lifestyles in the United States, and it is spreading globally. Instant gratification plays a significant role in the poor health choices we make. I would contend that there is a spiritual void that we are trying to fill with unhealthy habits. How then do we break this cycle? How do we reclaim personal responsibility to combat these issues? We can begin with SPIES, with the well-centered fitness approach. We can understand that we are not the center of the universe, and we must treat healthcare as a commons. Universal healthcare is not a human right, it's a personal responsibility. Universal health is a human right. Universal healthcare is not sustainable without universal health. We must begin to take better care of ourselves physically. We need access to physical activity and exercise, to healthy diets, and to healthy environments. We need to take advantage of provided access. We need to be educated, and we need to be educated of health and healthy living. We need to connect socially. We need to get to know our neighbors and our coworkers. There's a habit among Americans, as I mentioned, to say, "How are you doing?" and not really want an answer. We need to look out for one another. We need to be less self-centered and more other-centered. We don't need more medicine, we need more meaning. We need to understand that our bodies, minds, and communities are sacred, and only when we begin to treat them as such will the real healing begin. I challenge you to improve one area of SPIES in your life. Take one at a time. Make daily goals to grow spiritually, physically, intellectually, emotionally, and socially. Find ways to contribute to community well-being. Healthcare needs to be more proactive and less reactive. Demand that your doctors, your insurance companies treat you like a person and get to the root cause of your health issues rather than just writing a prescription and treating symptoms. Above all, take care of yourself and take care of others.